Okay.
All right, so welcome everyone. I am Alina Frank and I'm here with my husband and partner.
Craig Weiner.
And today we are here to discuss differences, similarities between EFT and EMDR. We get this question a lot. And when I thought about doing this series and thinking about that particular question, the one name that came up was Dr. Carol Odsess. So welcome, Carol.
Thanks so much for having me, Alina and Craig.
Mm-hmm.
Okay,
Nice to have you.
so tell the audience your history and connection to those techniques.
Sure. So I was lucky enough to get trained in EMDR starting in 1994. And I say lucky because I wasn't even licensed as a psychologist yet. I'm a licensed psychologist in the state of California. And I feel like I was lucky because I didn't have to unlearn traditional talk therapy approaches. My main modality right from the beginning was EMDR.
Mm-hmm.
And I really took to it and resonated with it. It's been a source of incredible joy and meaning for me for 30 years now, being able to help people so dramatically. And I went on to become certified by the EMDR International Association. And then the next level, which was becoming an approved consultant, I assist in EMDR trainings that are now done by Zoom. So there's people from all over the world. And one of the main things I've been doing work-wise recently is focusing more on providing consultation to newer EMDR therapists. So individually or in groups on Zoom. And I got introduced to EFT in around 2001. And after I went to my first class and then went to weekends and conferences and got all excited about it, I was integrating it with EMDR and talking about it to my professional community, EMDR therapists. And people got really interested and they'd ask me to come talk to EMDR therapists in different groups. And then they wanted to actually learn how, and I would create these day-long and two-day workshops. Then I started teaching continuing education credit classes for therapists. I was invited to train Kaiser therapists and therapists at other agencies and nonprofits, presented at some conferences. And at one point, I even had a class that was approved by the EMDR International Association on enhancing EMDR with energy psychology.
Wow.
So it was officially sanctioned.
Wow, I didn't know that. Okay.
Yeah. So that I haven't continued to do that because it just became too much paperwork, honestly, for the approval process. But yeah, it was really meaningful to me to get that official seal of approval.
Can I just ask people use the, like EFT, it's an acronym. What does EMDR stand for?
Yeah.
Let's just start.
Yeah.
Step
Good place to start. So the acronym stands for eye movement desensitization and reprocessing. It's quite a mouthful. What it actually involves is a comprehensive approach to therapy based on the idea that most psychopathology or maladaptive patterns and emotional disturbances are a result of negative events in our past that are held in a maladaptive form, and that can be shifted by a very detailed process of activating different components of the negative memories and pairing that with alternating bilateral stimulation. That's it in a nutshell.
Can you take that simple explanation?
Yeah.
And now bring that to EFT, because there's some similarities and differences there already.
Already.
Is that something that you can maybe speak to? Do you see the first half of what you said as similar between EFT and EMDR?
Well, that's actually a complicated question. I have a whole list of ways I feel they're similar and ways I think they're different. But the reason I say your question is complicated is because I think it depends on the practitioner and how they're conceptualizing what they're doing.
Yeah.
So
Okay.
starting with my list.
Okay.
Yeah.
Now,
Start your
why
list.
don't we begin with a list of similarities and differences? Since
Yeah.
you've done that. for us.
And I'll dig into that question a little bit more. So the main way they're similar is that they're both mind-body techniques.
Okay.
And obviously, non-therapists are also trained in EFT and use EFT for themselves, or can use it as coaches or other non-therapy people,
Right.
according to the laws of their state. But I'll probably keep using the word therapist because that's like my language, and people can change the word. But so neither of them are talk therapies. And whereas EFT guides people in tapping on the acupuncture points, EMDR guides people in alternating bilateral stimulation, like guiding people's eyes from left to right, or guiding people to tap, or other kinds of alternating bilateral stimulation. Both can have powerful or transformative effects. They can both reduce or eliminate the disturbance from a memory, and both can heal a problem to the roots rather than just managing a symptom.
Mhm.
And an example of this is like if someone has a fear of flying, rather than them just learning coping tools and skills and how to manage their fear and worry, when EMDR or EFT are successful, the fear can be eliminated or so substantially reduced that it's not an impediment to the person doing what they want to do. So these are huge similarities. And my next point gets to your question, Craig, which is I think they both depend a lot on the skill of who is using the protocol.
Mhm.
And to me specifically, what I mean by that is whether the practitioner understands that the roots of the problem or the disturbance or the symptoms are usually in the past, and whether they have the skill to identify what those specific things are in terms of feeder memories or core events. So that's why I think it's pretty practitioner dependent.
Mhm.
Right with right with you on that.
And I know from the experience I had with Alina that she is right on top of that as well. And in terms of the administration, they both usually use the structure of including what we call a SUDS scale, subjective unit of distress, measuring the disturbance of the event from 0, no disturbance, to 10, the worst disturbance imaginable, and keep track of it until it gets to 0. People aren't always that methodical about it, but they do share that structure. I think one element that's often not articulated is that both protocols share mindfulness, in the sense that we're with the negative event with acceptance and these healing procedures, rather than avoiding it, thinking about it, or ruminating about it.
Okay.
And in both cases, the therapist's task is to facilitate an internal shift within the client. So they really share that, in that they're not about the therapist being smart or wise or coming up with the best insights. It's all happening within the brain and the system of the client. And it's also not about the relationship with the therapist. While I think a good relationship with a warm, caring, kind, accepting person is only going to be helpful, that's not the essence of the healing. The healing happens within the client, which is one reason why these protocols both work perfectly well on Zoom, which often surprises people. They're like, how can it work on Zoom? Those were the main points I wanted to make about how they're similar.
Okay.
Mhm.
Would you like me to go on to how I think
I
they're
would
different?
love for you to progress. Why don't
Well,
we?
I just wanted to interject a fascinating little synchronicity event there with the two founders. Both founders say that there's an element of neurolinguistic programming in the process, and both of them developed the techniques in the 90s, and both of them lived in Sea Ranch, California, which is just like, what are the odds of that? Crazy.
And we should name them, Francine Shapiro and Gary
Right,
Craig,
and Gary
right?
Craig.
So, yeah,
Yes,
that's
true.
incredibly serendipitous, almost one of those things when something is meant to come through, it doesn't always show up at the same place at the same time, and but it does sometimes.
On the planet,
Right.
but here it is.
Yeah,
right.
absolutely, absolutely. I got trained by Francine herself actually in 1994, so I feel really fortunate. You know, she died a few years ago.
Yeah, yes, I know that. Yeah.
Yeah.
Okay, so tell us, let's share the differences from your perspective.
Okay, so one of the differences, so let's just get this out of the way, is that EFT is based on tapping on acupuncture points, pretty much the same points in the same order, or the alternative touch and breathe, holding each point, or mental tapping, whereas EMDR is based on using alternating bilateral stimulation. A whole industry has cropped up to support EMDR therapy. So we also can buy gadgets that provide alternating sounds, or we can use apps. We have paddles that vibrate, clients can hold in their hands or stick under their legs. We have bars of light we can use in person or on our computer screens. And there's web-based programs that provide circles that go back and forth, and we can change the colors and the speeds and whatnot. And so there's all these technologies. But to me, the more significant difference is that EMDR is an 8-phase comprehensive therapy approach. It's a powerful form of therapy. And in fact, I know one of your questions was going to be who's allowed to do which trainings. And the EMDR trainings are very strict about only allowing licensed therapists who see clients for the most part, or if you're pre-licensure, you have to already be working with clients and have supervision. If it's your first year or you're just in graduate school, they don't let you in. If you're a drug counselor, they don't let you get the training. Even sometimes licensed therapists, if they realize that they have an administrative position and they're not working with clients, they won't let them into the training. I've heard of doctors who want to get trained and they're not allowed into the training. So they're quite strict about it. And the reason is that I think of EMDR as the surgery of psychotherapy. It can be extremely powerful, and often it's very rapid healing, and that's wonderful. But sometimes on the way to getting there, clients can get dysregulated, because the power of EMDR is that unexpected connections can be made, where people have unexpected thoughts and feelings and memories come up that can be overpowering, overwhelming, or destabilizing, both during the procedure and afterwards. And we don't want to hear that a client had EMDR and then they couldn't work for a couple of days, or they couldn't sleep, or even worse, that they had to go to a psych hospital or something. So Francine writes repeatedly in her book that if the client does not have self-soothing tools that they can use, we should not proceed to the trauma processing portion of the EMDR protocol. So we also want therapists who have a background with the skills that can be used to both prepare clients and manage kind of their level of activation during the session, close it down so that they're safe when they go home.
Can I ask a question there?
Of course.
So one of the things I've always said is, from an EFT perspective, the beauty of EFT is just how quickly and deeply it can go. The danger and risk of EFT is how quickly and deeply it can go. And I'm hearing the same thing for EMDR because the connections of traumatic memories and unprocessed feelings, et cetera, can come up. So how do you see the difference with what you just stated, given the appropriate trauma concerns of EMDR, in my opinion? How is that either similar or different than EFT from your perspective?
Well, you know, it's so interesting to me. EFT is widely described as rarely precipitating abreaction.
Right.
Those are the words that you always hear. Abreaction meaning an overwhelming amount of like emotional affect coming up. And I think that is really, really true. And I think that's basically what the key difference is. So I try to understand it, and my best explanation is that I think EFT does more like desensitizing. Like it reduces the activation quickly, people feel calmer, whatever's bothering them is less disturbing, the disturbance of the memory goes down. Whereas EMDR does that, but I think it just seems to also have more reprocessing, where there's just more connections that are made, which can both, in my opinion, make it very thorough and very profound and very deep, but also connect to unexpectedly disturbing things or be overwhelming to somebody.
That is the primary feedback I've heard from therapists that have utilized both. Because I always ask, when the conversation allows, of their experiences and when and their differences. And, you know, I never want to be assumptive that that's true because it's not my direct experience, but it is a common reframe that a thought that I hear is that when I do EMDR, it is more likely to end up in an abreaction than EFT. And they say the same thing. I can't exactly explain why. That's just my experience. And of course, it depends on the skillfulness of the practitioner and how quickly and, you know, how trauma trained they are and how quickly and safely they go and how resourced the client is before they go to certain memories, et cetera. And of course, the individual application will vary, but that is something that I've heard. So it's interesting hearing you state that, because I respect the duality of your training.
Exactly. And that's why we have the preparation phase, so that clients are hopefully prepared, just like you're saying. And I'll joke around, but it's not a joke that preparation can take 10 minutes or it can take 10 months. You know, it really depends on the client and what's going on.
Preparation meaning, so I don't make any assumption.
Oh, yeah, that's a great point. Meaning that they meet our criteria for readiness for trauma processing. And people may define that differently, but it may be things like, and it depends, like also like you're saying, Craig, it depends on someone's skill and knowledge and training. One clinician is safe working with someone who's maybe self-harming or has problems with substances, and someone else, you know, isn't. Right. But it basically means that they have self-soothing tools that they know how to use and that they can use to manage the feelings that get stirred up. They're in a place in their life where they could tolerate the possibility of dysregulation. Like, ironically, if someone's out on disability, I'll be less worried about them getting dysregulated from EMDR versus someone who tells me they're hanging on by their fingernails because they got divorced and they moved and they lost their job and there was a fire, you know, and maybe it wouldn't feel safe to risk them getting dysregulated. And then another criteria for a lot of us is, you know, that they have maybe specific resources, like that they can specifically access a place in their mind that feels peaceful or calm or nurturing or protective figures. Right. I'll have people make a container. So we have like a lot more, many more steps in our process.
Do you think that's something that EFT could improve upon?
Well, that's an
No,
interesting question.
Because, for example, in our trauma teaching, we teach a lot about resourcing and self-resourcing, but it's not ubiquitously taught
No,
throughout the EFT world.
the importance of.
And I'm also
when
being
working with
conscious of the
trauma.
distinction between licensed and unlicensed, but we also know that unlicensed people work with trauma as well.
Yeah.
We can debate that, but won't right now. But given anybody working with trauma, would you advocate for perhaps more judicious use of some of these steps before doing trauma processing? I'm just curious.
Well, yeah, when you ask me directly, I would say, why not? Because better safe than sorry, right? Like on one hand, to me, EFT is literally one of those tools. Like I literally introduce, if I have an EMDR client, I'll literally teach EFT in the first or second appointment. Well, actually, I'll just say for several reasons. One is they get some immediate benefit of desensitizing something disturbing. Number two, they have a self-soothing tool they can use at home if they're dysregulated from our work together. And number three, I'm checking off one of my criteria for EMDR readiness. My little cheat sheet. So I think of EFT itself as one of those tools.
Right.
But one thing to be aware of when you're working as a practitioner with people is, are they actually doing it at home? So that, because when we do it in the office with them, they'll say, great, sure, simple. And we maybe we give them a handout and we tell them to try it at least once or twice during the week, and they come back and maybe they didn't even try it, or maybe they're like, I thought it was simple, but I can't follow your handout. What do I do first? What do I say? So if they're not actually using it, then they don't have that available as a self-help tool. So we have to actually make sure, like literally, that we watch them do it and we see that they actually can do it. But I think, why not give people several tools? I'll have people like write them on it, or I did paper in person, write them on an index card and stick it in their pocket or wallet or purse. So if they are dysregulated and forget all their tools, they've got a list. Because it's nice to have a variety. It's nice to have like, oh, there's a place you can go in your mind. That's quick and easy. Here's a guided imagery, thing that all you have to do is push the button. You listen to that. You don't have to do anything, because with EFT, you still have to do something.
Right.
Or here's a container, a mental container, or here's a reminder that you can journal or play your guitar, or etc.
It's so good, because working with my mentees, it's always kind of like, all right, do your EFT when you get upset. And it's like, wait a minute, you think after an hour or two session of you doing it with them, they have access to that? I'm always like, okay, how can we set up a practice? Let's start off with 3 to 5 minutes. How do they do it? Have them like actually voice how they would do it to you. Check in next time. So developing that EFT as a resource.
Right.
And it's really one of the beauties of EFT, because we say it's both a therapeutic tool and a self-help modality. But if, as practitioners, we're not teaching it as a self-help modality, then we're only relying on it as a therapeutic tool, whether you're a practitioner licensed or not. Still therapeutic.
Yes, that's one of the points on my list. Absolutely.
Oh, finish your list, please.
I completely agree. Yeah. I'll have people do it in front of me so that I can help them course correct and see that they actually know how to use it. And I'll tell them it's like a sport or an instrument. If you do it, you'll have it available at your fingertips. If you don't actually do it when you have a crisis or a disturbance, then you're not going to feel like you know how.
Right.
And one thing Francine Shapiro used to recommend actually was testing self-soothing techniques in session. So she'd have people think of something minor. I always say like a speeding ticket or a parking ticket that has a SUDS of a 5 or something like that. Think of it and feel the disturbance, and then try one of these methods, whether it's thinking of a peaceful place or it's doing self-tapping. or, you know, some kind of breathing technique or something like that, and then take your mind back to the disturbing event. Has it made a difference?
Yeah, that's
'Cause-
right.
Like that.
Yeah, because it's not like we don't want to just give people handouts or teach them tools. We want to make sure they can use them and they work. Yeah,
In situ before in vivo. Yeah. So yeah.
yeah, exactly. So yeah, so in terms of getting more into the differences, so I usually feel safe using EFT without having completed the history taking or preparation phases of EMDR. And that's great if something is coming up where I don't want to risk destabilizing a client or they're not yet a suitable candidate, like the you know, super traumatized person I described earlier. They're in a catch-22 where they need trauma treatment, but it's not necessarily safe to proceed with the EMDR yet.
Right.
I usually feel like I can do EFT. I'll often get calls, I'm sure you guys do too, of someone who says, I've got like a big licensing exam coming up for law or psychology or medicine, and it's so traumatized, and maybe there was a failure in the past, and they heard about this method and they want to see if it would help. And I mean, they're usually calling me for EMDR, and I say, when is it? And it's in a week or it's in 2 weeks. So I don't want to risk stirring things up for them, you know, like opening a Pandora's box.
Yeah.
But I'll offer them EFT instead. I'm like, you know, it sounds like, you know, talking, problem solving, etc. hasn't been enough. Are you interested in a different mind-body technique that I think is more contained and safer to use, that will help you more quickly without the risks?
Right.
Boom. Another difference is with EFT, the clients don't have to wait to get the treatment. I don't normally talk about clients because of confidentiality, but I have permission from one client to share this, which is she was viciously attacked by a dog, severely injured physically, traumatized mentally, couldn't work, was in pain, had trouble sleeping, had heard of EMDR, went to an EMDR therapist, and at the first appointment, the EMDR therapist heard the story. A week later, at the next appointment, the therapist got her history. A week later, at the next appointment, the therapist starts to prepare her for EMDR. And then she called a friend who told her about me, and she came to see me to say, a month's gone by and nothing's helped me yet. And, you know, I'm not sleeping and I'm completely upset. And I'm like, well, you know, let's just do some tapping. So it feels so safe. We don't have to wait to go through the proper steps of EMDR.
That's useful to hear.
Yeah.
Okay. Makes sense. Both ways make sense. And that's useful to hear that distinction.
Yeah. What feels useful about it?
I think it's useful to know making the distinction. Well, I mean, I respect the protocols that EMDR has for safety.
Yes.
So I don't have, but I do understand that the consequence of that can be time elapsing when there are tools that might be able to be utilized in a
Quicker.
more emotional first aid approach that EFT can utilize.
Yeah.
And I think sometimes, like, I know that, I mean, at least I know that about EFT, but sometimes seeing it just in the store of all the different things on the shelves is like, oh, I can actually recognize the usefulness, feel good about that, understanding I'm not necessarily working initially on other traumas and other, I mean, there are different ways in which we're using EFTs for emotional first aid, and we're still moving toward trauma treatment, let's say, but that there is a way that we can safely jump in. I mean, I don't want to get into how we're dealing with, you know, what happens when there's a shooting and a fire, and you know, there are different, that's kind of a different question about how we handled stabilization phases and what to do and what not to do. But just to hear that distinction is useful for me to understand, because I want to be able to know that there are places that maybe if he's not working, and you know, that's a question I would ask is, but I don't know that you're done with your list yet. But to get to the, when you are, why don't you finish your list first? I'll hold that back.
So one thing some people may not know is that when we do EMDR trauma processing, most of us are using appointments that are longer than 50 or 60 minutes. We're
Okay.
using 75, 90, or 100-minute appointments
Okay.
Okay.
so that we have time to say hi, check in, figure out what we're working on, and go through the process. Because a lot of us also won't start the trauma treatment portion of EMDR unless we have at least 30 minutes left in the appointment. So we can go
Right.
through this process and sort of,
Right.
get to the end of it. It can raise scheduling complications, and EFT can really be used in any time increment. So that's another difference.
Okay.
It doesn't put the practitioner in the kind of all or nothing, either, we're doing EMDR or we're having a talk session.
Okay.
Another difference that we've kind of been alluding to here is because EMDR is such a powerful form of therapy that is really limited to being used by therapists, there isn't really like a self-use or a home use component. And EFT is so much more versatile because you use the same protocol for home use, for symptom management, for stress reduction, or sophisticated trauma treatment. So I think a lack of clarity occurs, or apples are compared to oranges, when people criticize EFT saying that the effects are only temporary. Because I think it depends on how it's used and what it's used for. So I'll give you an example. When I came home after I'd done my first day-long EFT class, and I was all excited about it, my older son was 15 at the time, had a lot of homework stress. And my husband said, let's see if this can help Josh. He has a lot of homework stress. And Josh said, I'm too busy. I'm not interested. Leave me alone. I don't care. Which to me kind of like supports my theory that teenagers and pets are immune to the placebo effect, right?
Yeah.
So we cajoled Josh into trying this, and it was like, I'm like a raw beginner. I came home with my notes from my class and, okay, 0 to 10. How stressed are you about homework? 9. Tap, tap, tap. It's like a 7 now. Tap, tap, tap. It's like a 4. Tap, tap, tap. Mom, it's like, it feels the way I felt when the dentist gave me Xanax to do a dental. Seriously. I just asked his permission to share this last night. He remembered that. So to me, this is an example of like Advil, aspirin, they give a temporary benefit. They don't cure cancer, but we don't throw them out, right? And I think it's the same when we're using EFT for like, okay, let's just reduce the homework stress or whatever it is. A temporary benefit, especially when it can replace Xanax with side effects, is a really useful thing. I think the confusion lies when people don't have the clarity of, are we just using this for a little 5-minute self-help thing, or are we trying to get to the root of a problem and resolve a symptom?
Yeah.
Or they don't know the difference.
Yeah.
So I just did want to throw that out there. It's like
yeah.
one of my little pet peeves.
Can I just be clear? The example you used was an excellent example of EFT as a immediate first aid. But I just want to make sure, are you saying, because this is not something I hear, but maybe you do, that the long-lasting effects of the therapeutic, the deeper work of EFT have shorter term effects than EMDR? Is that something you hear or have witnessed? Because that's...
No, and I'm glad you asked.
I
I'm
just
not
wanted to be
trying to
clear on
insinuate that.
Okay.
It's just sometimes people will say the effects are only temporary, and I suspect it's either because they're not getting a skillful help that's getting to the roots,
Okay.
or the distinction hasn't been made explicit. So like, for example, if I was Josh's therapist and all I did was say, how stressed are you about homework today? Tap, tap, tap. And he only felt better for a little while,
Right.
It would be a valid complaint that the therapy wasn't diminishing his chronic homework stress.
Right.
Makes total sense.
That's why to me it's an apples and an oranges issue. And I do think there are people out there who aren't clear on the difference.
Yeah.
I think the same thing comes up with the criticism about using scripts. A lot of people criticize the scripts that are out there about EFT and the YouTube things that are out there about EFT. And I think those are often incredibly helpful for people, but often for short-term relief because they're not individually tailored to that person or that person's history. And again, I think there's this confusion where people say, it wasn't a miracle for me. It didn't change my life.
Almost like if we had two different names for type 1 EFT and type 2 EFT.
Well, yeah.
Oh, that makes
Yeah.
total sense. You were doing type 1 EFT, and I'm exaggerating.
Yeah.
But yes, they're very different. So
Yeah.
thank you.
You know, I like that. I like that. Yeah.
Okay.
Yeah.
Oh, go ahead.
Are there any other differences that you would like to share?
Other thing I came up with was that, you know, it's interesting to me how EFT has so much more verbal leadership from the clinician.
Mhm.
You know, we're literally telling people what to say.
Oh, yeah.
And, you know, that's really different than EMDR. That's really a different process. And I mean, that's usually how we do it, not always, of course.
Mhm.
So I don't know how much that's a factor in how it's more containing. But I think it's interesting. It's more interactive. Clients often like to hear what I'm thinking.
Right.
And, you know, often it'll make them laugh when we, you know, point out something or other or lead them along the merry way.
Yeah.
And I think EFT is great for groups because it's, you know, it's really
Mhm.
easy and straightforward to use for groups. The only other thing I think I want to say in my notes was EFT has a lot of sayings, like try it on everything and don't go where you don't belong.
Yeah.
And I think we shouldn't go where we don't belong with either modality. People can get so excited about them, but
Yeah.
we don't want to use either one with populations or problems we're not otherwise qualified to work with. Just because we learn EFT doesn't mean we should go do it with kids or
Yeah.
whatever. And I also just wanted to share with you guys and anyone else this fantastic book,
Mhm.
Oh,
Energy, Psychology, and EMDR by Hartung and Galvin,
okay.
all about this topic. It's a great book. It's 20 years old.
Mm.
You know, one thing they have in this book is a chart of when to use EMDR versus when to use energy therapies.
Oh, fascinating.
And I don't necessarily agree with everything in the chart, and it is now 20 years old, but I'll email it to you, Alina, and you can do with it as you see fit. It just raises interesting questions. So, well, what do you think about,
Right.
you know, what they have on this chart of, you know, 10 or 12 different items?
Right. And can we also say that the big difference is the way that it is perceived out in the world, especially with licensed mental health care professionals, that we can say that EMDR is evidence-based, whereas EFT now we can kind of sort of say something along the lines of evidence supported, maybe with a question mark.
Depending on who's saying it.
Exactly. And I think it just speaks to how it would, the origins, right? So Francine Shapiro really had her mind on, we're going to only train licensed mental health care professionals, whereas because she was one, and also because the dangers involved, but Gary Craig was more of like peak performance, you know, kind of like into self-development and professional development space, and his spiritual, you know, growth, and that's how it kind of developed from thought field therapy, right?
And with the strong energy focus,
With
which
the energy focus,
which
yeah,
has its pluses and minuses with regard to acceptance or perception or interprofessional acknowledgement, etc.
Yeah, skepticism.
Yeah.
What would you like to share, given licensure, given your EMDR perspective, where could EFT improve? And perhaps it's either training or it's clinical use, or I'm just kind of curious from your perspective, bringing the perspectives that you have, what might be useful?
That's an interesting question. I might need to think about that one because I think, again, it depends on who's doing it and for what population.
Yes.
I mean, I still remember seeing Alina teach and just how incredibly clear and skilled her thinking was. Seriously, because you guys want to hear something interesting, you know, because I ended up teaching so many groups of therapists and giving talks to, you know, county-based therapist groups. I would ask them, how many of you had any training in trauma treatment? And it was usually less than 10% of the people. So it's a really complicated issue because it's not like all therapists know EMDR and non-therapists don't. And it, I mean, I always feel a little sad when I hear therapists giving talks about all the trauma they're not able to help with. And I always think, why aren't they getting trained in EMDR? And you may have heard of Bessel van der Kolk, who's, you know, famous. And he has said on more than one occasion, it should be malpractice not to use your hands, meaning like doing EMDR. Because, I mean, and of course, EFT would fit the same, same situation. So it's a odd topsy-turvy situation when you have non-therapists who could sometimes help people more than therapists who only have talking tools. It's very topsy-turvy. But I'm happy to think about it, and I'm happy to look at any questions.
That'd be great.
If you want a second opinion about.
So, Carol, how can folks find you online if they want to reach out to you and see some of your work and maybe, you know, possibly consult with you? How do they find you?
So my website is my name, carolodsess.com. The most common problem is people misspelling it, and my phone number and my email are on the website. I haven't been taking any new clients for quite a while, but I do still accept people for consultation work, you know, in terms of coaching them on the work they're doing with other people. And I still, you know, accept invitations for speaking and training.
Great. Thank you so much. That was exactly what I was hoping for, and hopefully will illuminate others in understanding some of the similarities and differences, and know that there are differences, and yet we can both use both techniques either separately or together to help people. So thank you so much.
Yeah, well, you're so welcome. It's so nice to see you guys.